Hi, everyone. I'm Tammy Tibbetts, and I'm the co-founder and CEO of She's the First. Thanks for tuning in to our first Front Row Fridays episode. This will be a weekly series that my co-founder, Christen Brandt, and I will alternate hosting on Fridays at noon Eastern Standard Time. For 30 minutes, we'll address the issues and stories that you need to know about as a girls' rights advocate. We'll talk to our favorite changemakers about how they are prioritizing girls' needs during COVID-19 and about the specific risks that girls are facing, as well as how companies worldwide are leveraging educated girls to prevent the spread of the virus. We call this the Front Row Fridays for two reasons. One, it gives you a front row seat to learn from the ultimate girl experts. And two, the Front Row is the name of our monthly giving community. The Front Row is keeping She's the First going with monthly donations that are as little as $5 a month. This predictable income is power for nonprofits. So we pay tribute to them. Thank you to our Front Row members. And if you have the means to join them, please consider visiting she'sthefirst.org/frontrow. I now have the pleasure of introducing our first Front Row Fridays guest, Josephine Kamara. She is the Advocacy and Communications Coordinator of Purposeful, a feminist movement building hub for adolescent girls in Sierra Leone. Hi, Josephine.
Hi, how are you? Thanks for having me.
I'm so glad you're here, and I'm going to start out by telling our audience about some of your accolades. You are globally recognized for your work as a girl champion, and that includes being a fellow of President Obama's Young African Leaders Initiative. Josephine has been active in supporting girls who were orphaned as a result of the EBOLA outbreak in Sierra Leone. At Purposeful, she's been dedicated to activism to overturn a law in Sierra Leone that banned pregnant girls from returning to school, and she's passionate about building movements that are led by girls themselves. So, Josephine, I think the best place to start is tell us what's happening in your community right now as a result of the COVID-19 crisis.
Again, thank you very much, Tammy, for having me. This is a situation that calls for help for everyone. In Sierra Leone, currently, we only have about 8 cases reported, and close to 374 are quarantined. Among those 8 cases reported is a medical doctor for children, a pediatrician, and it's schools are closed at the moment, so it's a particularly crucial time for children, especially those who are doing street hawking, and for girls in general. Um, Anytime we experience situation like this, when girls stay home, there is going to be increase of sexual and gender-based violence. There's going to be, a lot of things happening to them. They're going to miss out in school. And at Purposeful, the safe spaces that we run across the country, that is reaching about 2,000 girls, is currently at a standstill. So all safe space program is holding on because the government is not allowing gathering, and just because it's the safest thing to do to not gather at this moment and practice the social distancing. But for girls' life, this is a very crucial halting the safe space program is very crucial for girls' life, because this is a platform, this is a space where they talk about the issues affecting them. This is a space where they dialogue solutions to their problem, and they go there and get vital information about sexual and gender-based violence, about female genital mutilation, and how they could really carry themselves in their community, about money management, about critical thinking and making decisions for themselves. So for the next, we don't know when schools are going to be open for, so we're all uncertain. So for the next 3-4 months that schools are closed, girls are going to be missing some of these, except for some programs that Purposeful is put in place that I will talk about later. But again, As I mentioned earlier, that rape and sexual penetration rate is going to really increase a lot. And it reports that Rainbow Initiative is the organization that provides free medical service for rape and sexual penetration survivors. Just last year, I just want us to imagine what is going to happen this year. Just last year, between January to September, 2,797 rape cases, sexual penetration cases for minors were reported in this country. And this is about 98% of rape cases that happen in total in the country. And that was just between January to September. And girls were still in school. So imagine now that girls are going to stay home. Most of them will be living with their abusers. Most of them are going to be in a situation where they are not going to be able to negotiate sex. Most of them are going to be faced with some of these risks. So it's going to be a very crucial period for girls' life. Already we're seeing it, and we're praying that what happened during the Ebola outbreak does not happen again. So this is the current situation in Sierra Leone at the moment.
Yeah, well, thank you for that recap. And at She's the First, we published a page, she'sthefirst.org/COVID, that brought awareness to this, of how the numbers of girls who are facing forced sex and pregnancy rates, all of these numbers skyrocket during a pandemic. At She's the First, as you know, our is with local organization program girls. And in Sierra Leone, our partner is Project Pekin, who you know. And we were talking to their leadership recently, and they described to us how families with the onset of this pandemic chose to move to more remote areas of the country, thinking that that would be safer than being in a city. But of course, when girls are further away from where they don't have mobile access or network connection, it makes it harder for community-based organizations to stay in touch with them and be kind of a lifeline. And that presents a whole host of other risks for girls. Could you kind of, for our audience, underscore the importance that community-based organizations play and how they're on the front lines during these times when schools are closed, to do everything that is possible to prevent girls from falling into danger, and in those worst case scenarios, to make sure that there's at least a plan for them to return back into the program later? Oh, I think you're still muted.
You know, Tammy, at this particular moments where it's not only for girls, but in general, people are safer closer to their relatives, to their family members. And this is a crucial moment where girls are moving, going back to the villages, because most of them were schooling maybe in bigger towns, and they have to go back to, their relatives where they could feel really safe. And even for the safe space programs that we run, it's very crucial. It's very difficult to get girls at this moment, because most of them have already, gone back to the different places, the different family members or carers that they are living with. But it's just a situation wherein girls are constantly put in a place where they have to be, caught, where their social capital have to be caught, where the friends they interact with, they're not going to have access to those friends again, where the places they used to go, they're not going to be able to go, because when they stay home, to be honest, they're not staying in luxury, they are working. Girls, do most of the house chores. They're going to fetch wood, going to fetch water. So they're absolutely working. And this is difficult for the community-based organizations that are providing support to girls at this moment. Because again, like I said, if girls don't get the crucial information that they need at this particular moment, we're going to experience the whole thing that happened again during Ebola, which is the Foreign Policy magazine referred to as the Ebola rape crisis that no one is talking about. And the sad thing is our community-based organization are going to be very distant to reach these girls, because this is a particularly unique disease. This is the first time they're saying that you really need to really maintain social distance. In Ebola, we experience that and we maintain social distance. But with this, it's like the news of social distancing is just everywhere, and people are trying to stay safe, and community based organizations are also closing down and trying to stay safe because government is shutting down a lot of operation in the country. So it's not only for the organizations, but it's also the decision that government is taking to ensure that people stay home and people don't go to work at this particular moment, and girls stay home. And so they are not able to go to where they access the information that is vital for their lives and all of that. So, yeah, I am just afraid because during that period when the Ebola was there, and we saw what happened during the Ebola, I worked a lot with female Ebola orphans during that particular period. And I realized that a lot of things that girls were missing at that period, that particular time, that was even making them give their bodies to men, is mere things like pad, mere things like food to eat, things that they could, use to survive daily. These were the things that girls were given, what we call transactional sex were given so that they will be able to survive. And the other unfortunate situation is we have those men who take advantage of children at this particular moment, and girls are going to be at the forefront of all of this. And the organization that's supposed to help girls at this moment are finding it very, very difficult to reach girls at this particular moment, except we continue to support them. And this is what I said in an interview 2 weeks ago, that this is the best time to reach out to those organizations that are directly implementing programs for girls, because at this moment the only way we can reach girls is through some of those organizations, although it is very difficult for them to also reach the girls at this particular state that we're in the country, but they are able to navigate because they live in the community, they stay in the community, they're able to navigate the community and reach girls with the necessary information that they need so that they can be able to go through this period safely.
Mm-hmm. Yeah, so we'll switch into talking about lessons from the Ebola crisis. And I'll start off with a fact that I pulled from a report that the Malala Fund just published yesterday. And they were drawing on data from the Ebola epidemic in Sierra Leone to make these estimates. And their projection is that about 10 million more secondary school aged girls could be out of school after the COVID-19 crisis has passed if dropouts increased by the same rate. So that is what we are all in a position now to prevent from happening. And for those who may not have been following the news as closely back in 2014 to 2016, now I think that is resurfacing, and they're hearing of how Sierra Leone was one of the West African countries that was worst hit by that epidemic. I believe there were more than 11,000 deaths reported in West Africa, but of course we know that there were so many deaths not reported. Could you kind of give some context into what it was like, even for you personally, to be living through that time, and having come out of it, what did the highlights of what the Ebola outbreak teaches us about how girls are affected and the best ways to prevent that?
There was also a report published by UNFPA that stated that about 17,500 girls became pregnant during that particular period. Because, like I said earlier, this is a period where most girls are going to be living at home 24/7 with their perpetrators, with their abusers. So of that rate that became pregnant, our government, in their own wisdom, said it was nice for these girls to be kicked out of school. So you realize that even when girls experience that traumatic event, they were being punished for a crime that they didn't commit on themselves. They were being punished after they have been sexually penetrated by just kicking them out of school. So the data in our country is saying that by the age of before now to when the girl reached the age of 18, by the time a girl celebrates their 18th birthday, about 28% of girls get pregnant. So we were kicking about that number of girls out of school. And you and I both know that the tendency for girls to return to school after pregnancy is very slim, especially when the school system is not very, accommodating. We've had testimonies from girls who are directly affected by a ban in Sierra Leone that says during that period when they became pregnant, they should not go back to school. We've had testimonies of girls after giving birth to their babies, they tried to go back to school, but the school system deleted them off the school record. And they didn't give them the reports card so that they could be able to enroll into other schools. We've had
Yeah,
cases of
Josephine, sorry to interrupt you, but since you mentioned that, we actually have a video to share with the audience that to hear from one of those girls named Hawa. And this is a clip that I think would be timely to show now before we continue the conversation. And it is from a campaign that She's the First and Purposeful did together a year ago called She's a Girl First. And the purpose of that campaign was to raise awareness of how just education systems at large around the world are not supporting girls who become mothers with their reentry back to school. But as Josephine said, at the time, there was a law that was specifically banning girls in Sierra Leone from coming back to school. And unfortunately, Hawa was one of those young women. So let's watch this 60-second clip.
School be locked for EBOLA, for the EBOLA outbreak. School be locked for a long time. But then the day I be 17 years of age, where I can realize say I get belly. I go school, I go like 1 week. I go 1 week, but they call the register. My name not the inside the register for 1 week. So I go meet my teacher. I tell her, I say they call name, but my own name they need to call her. Why? I tell me say let me go meet the boss, that the head teacher. Let me go meet her. So I go meet her. I go meet the head teacher, and he tell me say, he say my name not in the register. They don't pull my name in the register. Then I ask her, say why? He tell me say they don't tell and say me don't get belly, me don't bomb, me na young kumra. So let me go back now. Go start go make me pikin. And that's what he tell me.
Together, Josephine, was played on national television and radio across Sierra Leone. I know you did many media interviews at that time, just a year ago. And of course, the situation has changed, and we're going to talk about that victory. But before we do, can you elaborate on what was it like for you in the thick of all of that activism to try to overturn this ban?
So what we realized during the period of advocating for pregnant girls to go back to school is that the power of working together, the power of a movement works a lot. We realized that a lot of people were working in isolation on this matter, so we decided to bring all of them together, and we formed what we call the Coalition for Girls Education. Because, Tammy, to be honest, it is very unfair for a disease outbreak to happen in the country, and girls their bodies became the battlefield during that period. Because I don't know where I really cannot comprehend how men could take advantage of anyone in general, not to talk about children below the age of 18. We've had reports of girls as early as between 0 to 5 years of age being sexually penetrated during that particular period when everybody was asked to stay home. And this was a particular period when the world was calling for social distancing too. When Sierra Leone was saying, let's socially distance ourselves from each other, but men were busy preying on girls, on vulnerable girls at that period who could not, openly talk about their abuse, who were scared enough to talk about it. And the country that was supposed to protect its girls, this was a country that was now saying, throwing the girls under the bus. This was a country that was now saying, these girls are not fit enough to sit with our children in schools. These girls are not fit enough to sit with our innocent children. They use the word innocent. But what our campaign said was, before she became pregnant, or before she became a mother, she's a girl first, and she's still a girl. So it was unfair at that particular period. So activists were furious. I was particularly furious, and being a voice for that campaign throughout the country, I realized that the whole community was against girls. The whole community that was supposed to look out for girls, that was supposed to protect girls. We failed to give them sexual reproductive health education. We failed to give them access to the services that could protect their lives. Then we punish them for the inevitable pregnancy that comes after. This is a sad reality. It's just a definition of how we value girls in this country. We place less premium on girls. So at that particular moment, that curiosity was what led to that campaign. And we lobbied. We met with the Minister of Education, Minister of Social Welfare, all the influential people in the country that we know hold the power to change that ban, to overturn that ban. And apart from meeting with those high-level people, which we call lobbying with them, we also engage on a public campaign, a public awareness campaign, because a lot of people doesn't understand that during crisis like this, girls' body are used as a battlefield. That the stress that people goes through, they somehow pull all of it on a girl during crisis like this, and girls are at the forefront of all the dangers, of all the destructive things that happen. So we sensitize the community, we sensitize the whole nation, and we spark up a national conversation about this. And I am sure because of that consistent advocacy, and some of our partners were at the ECOWAS courts, Equality Now Waves, Child Welfare, were at the ECOWAS courts leading the court's case for against the government of Sierra Leone, while we were here with the Coalition for Girls Education, including you guys that joined force with us to make this powerful video that we use to call the government's attention to it. You know, it started with something, Mr. President, this is just not right, the full video. And that was just questioning the president's action. That was calling the president to change. And we're very proud, we're lucky, we're blessed to say that because of all of that concerted efforts, the Sierra Leone, as I speak to you, has lifted the ban officially on pregnant girls, so that all pregnant girls, irrespective of where they're coming from or what circumstance led them to become pregnant, are allowed to go to school.
Yeah, and that was such good news you shared with us on March 30th. So the ban was ruled unjust last year, right, at the end of last year by the courts, and it was just on March 30th that the ban was officially overturned. Is that right?
Mm-hmm. Yeah. So the ban was officially overturned on the 30th of March. You get. Hello. Are we still?
There's a little bit of background noise.
This is free time for me. This is free time for you.
Yeah, city living.
So
we were saying on March 30th was.
What's your question again, please?
So March 30th, you know, as this COVID-19 news just kept, it's like every day there's just such terrible news. And when you reached out to say that March 30th, this ban was officially overturned, it was a bright spot.
It was a bright spot, I know.
Years of advocacy and activism on your part and on many others in Sierra Leone. And I think what I'm hearing from you reminds me of a lot of times people at home, you know, doubt whether using their voices on an issue, a global issue, really matters or makes a difference. But it sounds like you're, as an activist who was on the front lines and had an ear with the decision makers, that you were able to use the local voices, most of all in Sierra Leone, but also the global amplification of those voices. A resource for you to use to create pressure on leaders.
Because if we want laws to change in Sierra Leone, if we want, you know, laws to be favorable for girls in Sierra Leone, it has to be grassroots owned. So this was what we did with this campaign. Local organizations who were furious about this ban came together, they used their voice, and we advocated with one voice. There was no radio station, no television station in this country that you will not tune and you will not hear a member from the coalition, a member from all the organizations working, having, you know, statements in those medium advocating for pregnant girls' rights to education. Yeah, so it's really a very good moment for us when the newly appointed Minister of Education, Dr. Moinina David Senge, when he took to cabinet this request from the people of the country, from the people of this nation, particularly the activists, the survival leaders, the people who were using all what they have to promote girls' education. And he took this forward to the cabinet. And on the 18th of March, cabinet sat on this, and they said that, you know what, go ahead, we give you all the political support you need for this. So there is this political willingness to, to lift this ban and to make girls' life, favorable in this country. And when they made that announcement on the 30th, we knew that it was as a result of our consistent advocacy. And we are also using this opportunity to call governments to pay attention to girls, particularly in a period of crisis, because this is a period where a lot of things are going to happen in their lives. A lot of changes are going to happen in their lives. Like I said, this is a period where access to vital information is going to be difficult. Schools are closed. Girls are not going to be engaged to do anything educational, except for a particular program that we're working on right now at Purposeful. So we are taking our safe spaces to radio. We are going virtual, because we understand that at this moment, when girls are staying home, they need all the information they can get about sexual reproductive health. They need all the information they can get about the use of contraceptive, about making decision, about critical thinking. They need all the information they need about staying safe during this particular period. So we're taking our safe space into radios, where we're bringing young mentors to talk to girls all across the country. Before now, we were only reaching 2,000 girls. And we got a new project that is going to reach 15,000 girls. But with the radio safe space, we are going to reach girls all across the country. And we're very happy for that.
Yeah, that's a fantastic idea and a way to adapt and create distance learning with using the tools that you have. And I think that's what I take away from this conversation. And when we talk about lessons from the Ebola crisis, we're all in a position now as a world to be part of prevention and put our advocacy and our activism into making sure the world is prioritizing girls now, so that there doesn't have to be years of work that you put in to overturn a ban, that those obstacles, we don't want them to be there. As we near the end of this conversation, that's what a note I wanted to end with you on, Josephine, is we talk about putting girls first all the time, but especially in moments of crisis. And, I believe and we believe that when we say put girls first, it's a way of expanding the conversation to make sure that they are included and that emergency response efforts are gender sensitive. We're not trying to say, one person is more important than another. It's expanding the conversation and recognizing that when we say put girls first, we do that because when you put girls first, they lift everyone else in the community up. So what is your take on that in terms of when we put girls first, what does that tangibly mean in terms of actions that we all can take today?
So yeah, putting girl first is very important, not only during crisis, but every time. In fact, there is a local saying here that when you educate girl picking, you don't educate the nation. I quote, it says, when you educate a girl, you've educated the whole nation. So a lot of people use that a lot, because in the home, like I said, girls are the ones that do the housework, right? Most of them do the fetching of wood, the fetching of water and all of that. So if they can be very instrumental in the home like that, imagine what they could do when they're educated. Imagine what they could do when they can go to school without harm. They can be safe in school. Imagine what they could do if nobody could penetrate them, if they grow up and they become very responsible adults in the future, and nothing affects them, and nothing like rape and sexual penetration affects them. It's a good thing. We need to put girls first. We need to support our girls, and particularly during this period, we need to look out for our girls. But again, before I go, I want to say this is an opportunity for us to reach out to the grassroots organizations, because they are actually the one reaching out to the girls. Whatever support we can, let's lend our hands to those organizations so that they could be able to reach girls at this particular moment.
Yeah, I think that's the best call to action to end on, and She's the First echoes all of those sentiments. We have 1 minute left, Josephine, and I think this is a good moment to squeeze in. You are such proof of the power of an educated woman and what you're doing right now in your own community. As you were telling me yesterday with the face masks, I would love to close out by you sharing how many you've made and the impact it's having on your community.
So I supplied 1,000 masks in 2 days. 1,000 masks in 2 days. So we started seeing a lot of people using the surgical masks. So we decided to do ones with fabric because this is reusable. We use flannel to do it, and then cotton. This is nice cotton cotton. So I gathered all the local tailors in my community, and I positioned them in one spot, and we're just producing overnight. We're reaching communities with this mask. We're selling to those who can afford it, but whilst we sell, for anyone we sell, we donate to a girl. So we've sold out 1,000. It means 1,000 is going to girls.
Wow,
So
that's amazing. And you're creating so many jobs in the process.
Yeah.
And it's, again, you are such an inspiration to all of us. You work with many young women and girls, and we're so glad that they have you to look up to as a role model.
Thank you so much for having me. I really appreciate it.
Well, thank you for your time. We will let you get back to work, and we'll be back here next week with my co-founder, Christen Brandt, interviewing another girl champion that you need to meet. Bye.